Good morning and welcome to the Ministerial Accounts of Stewardship here on Ebonyi Broadcasting Corporation, EBBC, Salt FM and Salt Television. My name is Amaka Isuchukwu. Please be aware that this program is streaming live on Facebook and on YouTube. You can find us just by searching Ebonyi Broadcasting Corporation. My co-anchor is right here in the studio. I'd let her introduce herself. Good morning.
A very good morning, Amaka. Looking radiant as usual.
Thank you.
Good morning, viewers and listeners. Welcome to the program Ministerial Stewardship Accounts. My name is Laura Amanzi. And of course, like we did say, that this program is being streamed live on all our social media handles. And so today we are going to be looking at the Ministry of Health. And who is the better person to talk about this other than the man, the arrow man, the man at the helm of affairs himself? We are looking at Dr. Ikenna Ekuma, who is the Honorable Commissioner for Health. Sir, you're welcome to the program.
Thank you very much.
It's a pleasure to always have you here in the studio.
Thank you.
All right, so let's start by meeting you. Who is Dr. Ikenna Ekuma, and what exactly does your ministry do?
Dr. Moses Ikenna Ekuma is the Honorable Commissioner for Health, Ebonyi State. I'm in charge of Ministry of Health as a commissioner, and the mandate of the Ministry of Health is mainly to provide quality and affordable health services to Ebonyi residents, and also to checkmate health-related activities in Ebonyi State to ensure that it is in line with the best practices.
Again, we say welcome, sir. Thank you so very much for coming. Please be aware that this is an audience participatory program. In the course of this program, we are going to open the phone lines so you can call in, ask your questions, make your observations and comments. You could feel free to also drop your questions and comments on our Facebook page at Ebonyi Broadcasting Corporation. And you've heard from the Ministry of Health Commissioner. All right, I would want to say in the year 2024, the ministry had a budget of about 89 billion naira. And in 2025, there was a substantial increase of 111%. And that you had a budget of 39 point something billion naira. I mean, we know how you have been able to use these additional funds to increase service delivery in Ebonyi State.
Thank you very much. As we know that the present government of Ebonyi State, under the leadership of His Excellency, Right Honorable Builder Francis Ogunanwifu, has health as one of her priorities, and that is why the budget of Ministry of Health was better than what it used to be. And that has been used judiciously to improve the health sector of the state, right? Starting from employment, which the government, since inception, has employed approximately 700 medical personnel in the Ministry of Health. And also, the government has procured basic medical equipment and consumables to all our general hospitals and some of the selected primary health care facilities. Then some of these budget was also for health insurance coverage. Before the administration of His Excellency Right Honorable Builder Francis Ogunanwifu, the health insurance coverage of Ebonyi State was about 35,000 people. But now we have about 137,000 that are under health insurance. So, and there are other things that the budget was used for, like in revitalizing 171 primary health care centers in the state. 171 in the sense that one selected health facility per each INEC recognized political ward. Then also our health training institutions were not left behind. We have School of Nursing, Sciences, UBRU, that was admitting 80 students per session. When this administration came in, said, considering that some health workers are leaving the country, we want to increase the quota. So we upgraded the institution, and first upgrade, the council that is in charge of that training institution now approved the admission of 120 students per session. From there, we said, no, it's still not enough. All that things were upgraded then. So, and we invited the council again. They increased it to 180. So that place is now is the College of Health Sciences. Then we also have another College of Nursing Sciences. We also have another training institution, health training institution in Zambo, the College of Health Technology. So some of the funds were also used to upgrade those training institutions, because we don't want a situation where, because of what is happening in the country now, where people are, health workers are leaving the country, we're also upgrading our training institution to increase the number of health workers we are producing. Some of these health work, students in training, we are giving scholarship also, such that when they finish their training, they will also work with the state, and it's a full scholarship. So all these are part of what the fund was used for.
All right.
Then, okay.
Okay, just before you continue, Honorable Commissioner, now you talked about the revitalization of the 171 wards, health INEC wards.
That is
primary health, yes, at the PHCs. Now, can you be more specific on how it has translated to a better health delivery services, especially in the rural areas?
Yes, that has markedly impacted positively on the health delivery services. Using the indices we used to check.
What are those indices?
We talk about the maternal mortality rate. Before we came in, it was over 840 something per 100,000 life births. But now we are talking about 400 and just around 400 maternal deaths per 100,000 life births. What that means is that we've almost reduced it by half. And what we are now.
So you were saying it was 800 before? 800
yes, above 800.
Okay.
Above, and that above 800 was above national average.
Yeah.
But now we've reduced it even below
400.
Below national
average.
So, and also in the case of under 5 mortality, there is also significant reduction, up to 2% below what we met it, where we met it. And also in infant mortality, there is also marked reduction. I can also, maybe I finish, I give you the figures, you can add it to what
it would be really nice to have this figures.
Yes. We also talk about the number of hospital deliveries that have increased. So all these are what the indicators we use to monitor the improvement in the health sector. So it has really impacted positively on the health sector of Ebonyi State. And even those patients they used to bring, if we ask tertiary health institution in the state, they can attest to this, because they've not been receiving those bad cases that used to come from
the rural areas.
So that is the impact of that. And now our general hospitals are revitalized. So most of the cases end up, if the ones they cannot handle at the PHCs, end up at the general hospital. And the government has also provided ambulance services for prompt referral. Recently, we launched emergency medical services and ambulance system, where a pregnant woman with challenges or under 5 child, the parent can dial 112 and the ambulance will go for such.
So you're saying I can dial 112 on my phone right now?
Yes.
You mean that is you're referring to the tracking of those that come for what do you call it?
Is
yes.
more for maternal
and child, yes, under 5
children.
So you're saying that the tracking system is effective.
Yes.
Okay. So this tracking system, is it in all the PHCs across board, or are they specific local governments?
No, there are selected health facilities where you take these patients to. Those centers we have upgraded to the level they can take.
How do we know which centers have been upgraded?
Like now, all our general hospitals are into these services.
Okay.
And a few private health centers, health facilities.
Private or primary health facilities?
Private, a few private health facilities.
Okay. So I am so glad that Ebonyi State has been able to bring down the incidence rate for infant and maternal mortality. That's a huge one. I think, Laura, that was last month, or was it 2 months ago, we saw that case in Lagos where a pregnant woman died because the husband couldn't pay 500,000.
Exactly.
So we are glad that is not an issue we face in Ebonyi State.
Yes.
And I was also glad when you mentioned that part of the increment in the budget, according to the ministry, was funneled to the National Health Insurance Scheme in Ebonyi State.
The State Health Insurance.
Yes, the Ebonyi State Health Insurance Scheme, EBBC. And that brings me to this question. Now, the proposal was to enroll 80% of the informal sector into the Ebonyi Health Insurance Scheme. I know that when this started, some people came to the office and, I thought I had enrolled. Until I went to the ministry and I was told that I was supposed to come to the ministry to do something which I didn't do.
I had the same issue too.
Yeah, and so that had been closed. I was thinking maybe it would be a good opportunity to change my glasses, right? Considering that things are getting very expensive now. And I was told that window had been closed. Sadly, I cannot remember exactly what that window is. But can you just bring us up to speed on Ebonyi Health Insurance Scheme? Is enrollment still ongoing? Aside filling the first initial form, what else? Because some of the cases we have as pertains to maternal and infant mortality is just because people cannot access Medicare owing to economic challenges. But I believe that if people are enrolled on this, it becomes easier to pay the bills.
Thank you very much. The vulnerables in the states, many of them have been enrolled into the health insurance scheme.
Okay.
Apart from the state government enrollment, Her Excellency, through her pet project, BEWO, is also enrolling pregnant women.
Okay.
Just as I told you, on average, now we have over 137,000 enrollees into the health insurance scheme. How does it? How do you do it? Like now, you talked about window period. We are enrolling the vulnerables. When I say the vulnerables, I mean like the pregnant women, the less privileged, the under 5. And sometimes you enroll somebody that is under 5 this year, maybe in the next 2 years.
The person would have been above 5.
Yes, then that person will be exited from the system. Then another child of less than 5 years will now be enrolled. That is how that one for the vulnerable, especially the under 5 children, works. Then pregnant women, it's not for, sometimes pregnancy lasts for
9 months.
9 months.
No
So
more.
we just enroll them for one year. The woman will deliver, and that one, another pregnant woman will replace that one until she gets pregnant again. Because the scheme, for example, if it's that of pregnant women, it's for pregnant women. It's not like even
For every woman, it's just for a pregnant woman.
no. I'm talking about the
Yeah,
scheme
the one for the pregnant woman. That's what I'm
Then
saying.
the
It's
one
not for
for
everyone.
state civil servant. That one, as far as the person is a state civil servant, you can go for the enrollment. And it's not only filling the form, because there is the database. There is still data capture that the person is supposed to do. So
yeah, that is the question Maka was asking. Now, for some of us, me inclusive, they came to our office and we filled forms. Now, we were not told at that period, and we felt that was it. We had filled the form.
It was only about filling forms.
Yes, and because they came and did all that capturing and whatnot. But now when we want to access the Medicare, we are now told that we have to go again to their office and fill out that forms. And by the time we got there, they said the window has been closed. So is the ministry doing anything towards that? Because there wasn't enough sensitization for some people to know that after the capturing in your various MDAs, you still need to go back.
Okay, I'm going to follow up on that.
All right.
See what you mean. That for the state civil servants, is the enrollment is continuous. Yes, for those that have not enrolled.
Okay, so when you said currently we have about 137,000 enrollees, don't you think that's rather minute for a state that has a population of more than 3 million as of 2022?
Yes, you know, this thing is still work in progress.
Okay.
But just as I told you, we came with a data of 35,000. And check it from 35,000 to 137. Is that not within?
No, kudos.
Within 2 years.
Yeah, it's a good increase. But we're just asking for more.
What as you just like you said, when you check the number of people that have delivered in our health facilities because of this, you really know that it has impacted positively, and the extent of reduction in maternal mortality and other parameters like under 5 mortality. You now know that this also has a very positive impact.
All right.
Then
go ahead.
Also, presently, Ebonyi State government is upgrading 26 health facilities to an ultra-modern health centers. That is apart from the 171. Yes, there are another 26 selected facilities that are being upgraded now. And
selected
what do I mean by
171?
this? I mean we are going to, in those ones, work has started in those facilities. We are upgrading, we are building the center, the health center, as in the clinic.
Okay, so they are not selected from the 171.
No, they are selected. They are out of those 171. We've not decided
to pick some. Okay, two from each local government.
From each local government to upgrade it higher by providing staff quarters, making sure there is water, there is fence, there is alternative power supply that will solarize the PACs, provide the equipment including ultrasound, then do landscaping for those facilities, and make it just higher than the other health facility, just almost like a cottage, the hospital, because we are going to have quarters in those ones, and work has commenced on those the 26.
When are we expecting this to be completed?
Well, we're expecting it to be completed within 3 months.
Within 3 months?
Yes.
All right. When did we start? Because I want to know when be that 3 months. I can't wait to go.
Yes, so because we are going to be monitoring that.
Yes.
Okay.
The 3 months, we will start counting from
today?
You can from middle of April.
Okay.
That was when
May, June, July.
All right. That brings me to disease surveillance.
Okay.
Yes, let's go into that, because Ebonyi State has been known to have this issue of cholera and Lassa fever. Every year we have that outbreak. As a matter of fact, last year, I think we had about 394 cases and about 23 persons dying from Lassa fever. Now, what have you put in place to control this, and what kind of surveillance are you also synergizing with NCDC? That's Nigeria Nigeria Center for Disease Control. NCDC. So, what is Ebonyi State doing to ensure that this constant outbreaks that we have, especially as it has to do with Lassa fever and cholera, that is being curtailed?
Yes, I was coming to that angle. You know, we've successfully curtailed cholera outbreak in the local government where this outbreak of cholera hit badly, like in Izi local government, in Ohuku local government, Ikwo, and even part of Ezanot. So those things, we were able to do that successfully, though we lost some patients, but those patients we lost were almost all of them were not in the health
centers.
Not in the health centers.
They were at home.
They were at home. It was before the intervention. You know, cholera can kill within hours. So those ones we lost were actually in their houses. So, but now, since that outbreak, we've been on it. We've been, giving people health talk on how
to stay safe.
To stay safe from getting these diseases. We've also made efforts with federal government to provide a vaccine, cholera vaccine, for Ebonyi residents. And it was the Ebonyi State government was the first, Ebonyi State was the first to do this in the southeast. So cholera vaccines were also given to some of the Ebonyi residents. But like every other immunization in the state, some people still did not turn out for that exercise. But we also plan to repeat it with time. Then for the Lassa fever, yes, Lassa fever, Ebonyi State is endemic for Lassa based on the location, and it has like a peak period. So, but the State Minister of Health has always been prepared to handle
outbreaks.
The outbreaks. But the problem with Lassa fever is that, it presents like malaria initially. So people have been, before presenting to the hospital, it's always at the late time. But we've been sensitizing people, going to the villages, especially those areas that are more prone to this outbreak. And we've been also, it has something to do with the environment, telling people to keep their environment clean, avoid rats, and cover their foods, including the raw food like gare and semo, all those things. When you open it, you should put it in a container that is covered. And we also have our emergency preparedness. We have the teams that we've been training and retraining on how to respond to this outbreak. And health education also. These are some of the preparatory measures. And just as you said, NCDC is the agency that is in charge of such
disease controls.
Such disease control. We've been collaborating with them. So we have our emergency preparedness items ready.
All right,
so that's what we've been doing. And from time to time, we also put up our jingle, telling people, reminding people what to do to avoid this disease control. I
think in terms of that jingle, maybe it's about time you upscaled, right, to having programs. Instead of waiting for these outbreaks, we have programs, the law of reputation, just put it right there in their face so that we'll make a change before this happens. Now, just before we open the phone lines, you've talked about having training institutions where people, health personnel are being trained in Ebonyi State, so we make sure we have them in good numbers. But the Japa syndrome is serious in Nigeria, and I don't think the Ebonyi health sector is exempt. Are there measures to make sure that our best brains do not leave?
Thank you very much for this question. Just as I was talking about employment, in Ebonyi State, we did not only just employ health workers. we had that at the back of our mind, that people are leaving, health workers are leaving the country. So because of that, we decided to give incentives to our health workers. As we all know, the state government provided SUVs for the medical officers, brand new. So apart from that, their quarters, we renovated the health workers' quarters in our general hospital. Okay. To make it short, His Excellency directed that we should make it, should do it such that it will be better than the accommodation they can afford in the city. Mm-hmm. And that's what we did. So then those ones in the health centers were given motorcycles to also help them respond promptly to emergencies. And the rural posting allowances have been paid in the state. Those health workers that are outside the state capital, they are receiving
rural posting allowance.
Rural posting allowance. Then also the fuel allowance that was approved by His Excellency, fuel allowance of 150,000 for a doctor, a medical officer. So instead of people leaving the health sector of Ebonyi State, what we are seeing is that some people came back from the popular Saudi Arabia and applied to join Ebonyi State Ministry of Health. And we have some of them that are working with us, and we still have some that have applied and we've not
responded.
So the issue of Japa syndrome, those ones that are already in our system, I've not seen anyone that resigned.
Okay.
That is maybe going for greener
pastures.
Because the incentive is
it's robust.
Okay.
It's robust.
So I think this will be a good opportunity, a good time to open the phone line, sir.
Okay.
Yeah,
and as we said, apart from that, we're also making preparations so that if at any time people decide to leave, the number we are producing, we can still will not lack.
Let's not probe into that. Now, let's open the phone lines.
Yeah, just open the phone lines and because we're going to talk on that, the Japa syndrome thing, because I think it's still something that Nigerians and even Ebonyi is still battling with, especially as it has to do with that ministry. But then let's open the phone lines. And
the phone number is 0813-593-3112. Again, 0813-593-3112. It's right there displayed on the screen. And if you are following us on Facebook, the number is also displayed there for you to see. 0813-593-3112. All we ask is that when you call us, you turn down the volume on your radio set or on your television set so we hear you and we can flow. Feel free to drop your questions, your comments on our Facebook handle. We have our first caller here. Hello.
Hello.
Good morning, sir.
A very good morning to you, comrade. I forget your name.
It's fine. I'll go with I forget your name. Thank you. Tell us your name or where you're reaching us from.
Amaka Ichiku, and also comrade Laura Hamani.
All right, you will.
The Honorable Commissioner for Health in the studio, Dr. Iken Ekoma. I salute you, my brother.
Thank you very much.
Yeah, this is the voice of Ituma, reaching you live from my Zaro Gapatiki, the native of Family Chisha, in the local government of Ebonyi State.
Okay.
Go ahead, now that we are done.
I want to appreciate His Excellency, the Governor, for what he's doing in the ministry of health. I'm very, very excited, okay? But I want to urge all the workers in that ministry that they should put more seriousness on their duty because health is wealth. And if they can put more effort, and I want also to appeal to the governor to help also to characterize the welfare of workers in that ministry so that they will be happy and deliver on their mandate. Okay? Thank you and God bless you. I'm very, very happy with you, the Honorable Commissioner. Thank you and God bless you, my brother.
Thank you. Thank you,
Thank you very much.
Okay, 0813-593-3112. Laura, you are going to bring up the Jakba issue.
Yes, the issue of Jakba, I know that when the partners and donor agencies were more before the advent of this present administration and even that of the American Trump, there was a lot of foreign donors and interventions that was going on in the States. So, and I'm wondering, now that some of those interventions have, they've closed up, a lot of them closed up last year. Now, are you leveraging, or how are you leveraging on what they put on ground? For instance, when we talked about this tracking and then provision of vehicles and other means of transportation in the rural areas. My question is, how is the ministry trying to continue with those trainings that these foreign agencies were bringing to bear in Ebonyi State, because there was quite a lot of them. I can mention in the area of malaria, I can mention in the area of this child mortality, tuberculosis, and a whole lot that they were doing. So is the agency still carrying on with, the ministry, is it still carrying on with those trainings that they were giving to people? Because it included both the formal and informal sectors, those that are with the ministry and those that are not with the ministry. And since you came on board, I really have not heard, because we were also part of those trainings, I've not heard the ministry calling those people that they had already on ground for those trainings to continue. So what is the ministry doing in that area?
Thank you very much, ma. You know, we are not just working. As we are working, we are also assessing results of the work we are doing. And we now discover that for those trainees that are very impactful to the system, we are sustaining those ones. How do we know those ones that are impactful? From, when you check the results, people that have been trained on this, how does it affect their work? If we discover that those things has positive impact, so we continue on those ones that has positive impact. And as we all know, Ebonyi State government, under the leadership of His Excellency Right Honorable Brother Francis Obonam, is ready to take the challenges. He knows that those people came to assist, and not that you will leave the sector
to them.
To them. So, and that is why, like in our immunization sector now, we have our cold room completely solarized. Before we came, or when we came newly, sometimes we move our vaccine to a nearby state because of the epileptic
power supply.
Sometimes we move to Enugu, sometimes to Abia. No, we're having all these challenges. And for vaccines to be potent, it must be stored under optimal temperature. So, but he said, what is this that we cannot do there? Let's do complete solarization of the cold room, such that if we pick vaccine from there, we'll be sure of the potency. And that project is not an easy one. It is only Ebonyi and one center in the North Central, one state in the North Central that have done this.
So that's to say other states now come here to put their vaccines?
Not really, but what I'm saying, at least from our own
Southeast
center, we are sure that
Ebonyi is not facing such a problem anymore.
And is paying counterpart fund for every immunization activities. So some of those things they were doing, the state has taken it up. We have our situation room where we monitor some of the activities of the
let's just hold that. Let's hold that thought so we'll get back to the phone lines. Hello.
Hello.
Good morning, sir. Your name and where you're calling us from, please.
I'm Patrick Wong from Iko.
Patrick Wong from Iko. Thank you for calling.
Okay, I'm greeting the commissioner in the house.
Thank you. Good morning.
Yes, I wish to express my profound gratitude to the work of the governor of the state on all areas, not only on high areas. Are you hearing me?
Yes,
Yes.
please go ahead, Patrick.
Good. So I only want to point to my own affair.
Okay.
That I had 2 circulars. And since the session of this program, if the commissioner has talked about it, maybe I'm not with my ears at that time.
Okay.
So when the wife to the governor was registering them, they were all engaged in their studies in other states. So they were unable to meet up. When they returned, I carried them to the ministry, to extra office, but they told me that the session is over. So since then, I paid for one of them as a counterpart. I paid my counterpart. But after 3 months, they said my counterpart free as the last. I know the issue of these circulars, when their crisis arises, I always find it difficult to cope with it. So I wish the commissioner to advise me on what to do. So I'm very grateful. Thank you very much.
Thank you, sir. Please hang up. He will respond. Please go ahead, sir.
Okay, thank you very much for your question.
Excuse me.
The health insurance for circulars was done or carried out by Office of Her Excellency, the wife of the Executive Governor of Ebonyi State, through her pet project, BEWO. About 100 sickle cell patients were to be enrolled. And maybe by the time you brought your children, you've gotten up to that, that number. So we still hope to expand it, but that we've not started again. So it was not like open for
Everyone.
There was a number there, 100. So
Okay.
that was what happened. Because before that enrollment, we didn't know that we had so many of such patients. So now that we know, we've been compiling names of those ones that we are not able to be registered, so that when we open that chapter again, those ones that have not been enrolled will be enrolled. So thank you very much.
Okay. So let's take another call now. Hello?
Hello.
Hello, good morning.
Amaka is the Chuku and Laura Maz. To meet my back on the line.
All right, please go ahead.
Yeah, I want to verify from the Honorable Commissioner concerning the issue of extra programs like hernia surgery and a lot of them. It is still going on now because there is one, some people in the rural area have such problems, especially in my community. I'm a teacher. So I want to verify whether the role is going on so that I will come and put some of the name of those people before they will die, because the performance of the governor, I love the performance of the governor, so I need to verify whether they are still on, so that I will come and put the name.
All right.
Okay?
Thank you very much.
Yeah, thank you.
He wants to know if enrollment is still on for hernia surgery.
Those things were like specific intervention. We had the number we did at that point.
Okay.
Is this
Yeah, so,
Yes,
yes.
go
Okay.
ahead.
So it was also, there was a specific number at that time. I can't remember the exact number. So it was like not like a continuous exercise. But now we know that there are still many Ebonyi residents with such a condition. So just like what I told you in the sickle cell, in case of sickle cell patient, we will now compile names and know how we repeat what we did before, free hernia surgery. If we got after compiling, we don't know how many that have not been attended to. So it's not like something you can go at any...
Are you saying they should come to the ministry and put down their names?
Yes.
Okay.
They should come to the ministry and put down their names. We want to have the data.
You know, the ministry is a huge place. Where particularly should they go
exactly.
to?
Which department?
The Department of or the Health Insurance Agency.
Okay.
That is where they should go and write their names.
Okay.
Write their condition. Those conditions we've registered before, like sickle cell patient, hernia patient. Recently we did surgery for people with cataract. So, and initially we did for 400 people. Then recently we did for 200 people. But it's not like ongoing exercise now. So what happens is that for people that have such condition, they can still put down their names.
So there's profiling you do first.
Yes.
Okay.
To know.
Okay. So our phone line is still open, 0813-593-3112. For people like me who want to change my glasses, can I go and put down my name on the EBBC website?
To change your glasses.
Yes, and even me, those of us that are having eye issue, we have to read and read every day. So, and the EBBC thing is still not, is no longer open for us. What is our fate?
We did, let me, if I should use that word, it was like a promo for civil servants and need glasses.
What we are saying is open the promo again. Or should we go and put our name for the promo to be opened?
Let's see what will happen. When we gather the number, we will not know.
So we should go and put our name.
That's precisely what we're asking. Can we come so that it will be captured? Let's profile us, and then we know that we have been profiled.
Yes.
That's what we want to know.
Let's take this call, please.
For those...
Hello.
Hello, good morning.
Good morning, sir. Your name and where you're calling us from?
My name is Samson, calling from Abakaliki.
Samson, you're welcome to the program. Please go ahead.
Honorable Commissioner,
Good morning.
one thing about the health in Nigeria and Ebonyi is that they always wait to virus and disease to start locating. But it's not bad, it's not good like that. They should be prepared before the emergency of any disease. And again, I can remember when my late father joined one of the teams to fight Syria, and succeeded very well. Health is above the military and is above other things. Between 100% and 100% is what I expect by a state government to help is 7%.
All right, thank you so very much, Samson. Even though really we are lost as to what you just said.
Well, I think if I got a little bit of what he said, he was talking about the Ebonyi state government being proactive. That during his late father's period, where they were talking about the days of Guinea War in Ebonyi state, that proactive measures were taken more and not waiting to be reactive. I think that's basically what I got from what he said.
Okay, so that's like a commendation.
No, that he's wanting them to be more proactive and not reactive.
Okay. Yes, only. That is almost like what you said earlier. How prepared are we for emergencies? And we have our emergency team ready. We've procured, like now, we know that this is period for cholera. So we have those things. We need to intervene. Then we're also educating people about this condition, health education. We are telling people how to prevent cholera, how to, such that they will not come down with such disease condition, because this is like a first. So what happened now is that all the sometimes waste from
dump sites
can be washed into our water. So we are prepared for that now.
I don't know, can we have a caller right now?
Go ahead.
Okay, it brings me to the issue of water and hygiene. That is the wash. You understand? So I don't know. What are those facilities you have put in place? Now, Ebonyi is still battling with this issue of open defecation, which at this point in time, we are talking about cholera. And these are some of the reasons that you have things like that. When you're living in an environment where you have uncompleted buildings or you have open land, people come there to defecate. So how are you collaborating with the public health sector? What are you doing with WASH to ensure that some of these not nice practices are stopped, are nipped in the bud in Ebonyi State?
You know,
All right, please, just before you answer that, let's take this call. Hello?
Yes, very good morning to you in the studio.
Good morning, sir. Your name and where you're calling us from?
My name is Meka Moko, calling from wonderful Addiction, Mr. Local President.
Mr. Meka, you're welcome to the program. Please go ahead.
I just want to talk about the area of child spacing. I don't know what the state government is doing.
The area of what?
Ensure that child spacing,
Childbed
people are being sensitized. Because the way people keep back now, I think we should embrace that child spacing so that it will help them carry out or train other children. So I don't know what the government is doing. It's very, very good for us to welcome child spacing, the use of contraceptive and that thing. Thank you.
Thank you, Emeka Nwokoro. All right, so you can react to this.
For
and
the
then
area of
WASH.
What we've done is that we've established or inaugurated one health team that involved the Ministry of Environment, Ministry of Agriculture, and Ministry of Health. We've been having meetings and brainstorming because we have to work together. So when you talk about open defecation, is the way, because before now we used to have Ministry of Health and Environment as one ministry. Now we have Ministry of Environment, and some of these challenges, those things we are talking about, are more of environmental issues.
That has health impact.
That has health impact. But what we've done is to have one team, and as we know, at open defecation, there is a law against open defecation in Ebonyi State. No, people have not been really observing that, but we are also doing health education on it, and we'll be meeting with even the local government chairman on the need to provide toilet facilities in public places, such that, because that is one of the major ways of stopping this outbreak of cholera in our state.
Yeah, because if you go to places like, places like international markets, Amaka, you recall there was a day we were passing through towards, I think, the lot 3.
At every of the lots, actually,
you understand?
You see public places where people urinate.
Yes.
And all of that. Even when there are facilities that have been provided in the markets,
they are not being utilized. So, and you find this, it is an eyesore.
Okay. So we are going to enforce that with the Ministry of Environment. People should use the toilet facilities instead of dumping their waste in open places, because that has been has not been a good practice, and it contributes to the outbreak of cholera we are experiencing in Ebonyi. Then childbed spacing, we are doing much about it, because what we used to see is that if there is no pregnancy, there will not be any maternal mortality. So we are trying to avoid unwanted pregnancy as much as possible.
I thought you wanted to tell people to stop giving.
No, it's unwanted pregnancy that we are talking about. Right. Not that people should stop giving birth. You know, it's more, in short, unwanted pregnancy contributes significantly to maternal mortality. And even in our budget, and we've been procuring family planning commodities. And as you said, some of the partners in the state have also been contributing in that regard. So what is not a problem of lack of commodity, is a problem of people not going to assess it.
The reason why people are not assessing it is the framing of the message. You know, telling an average Abakaliki man that water girl is, you know, kind of says you're not able to take care of a certain number of children. That's like bruising his ego. Could it be the messaging that is...
No, in Ebonyi State, what we are talking about is, you know, avoiding child spacing, as you call it.
Childbirth spacing.
Childbirth spacing, at least given interval of 2 years. Then, and another thing we are talking about in the state is about unwanted pregnancy. We cannot force somebody to, you know, limit the family size, but we want it at least child spacing is very good for the mother and also for the
just
for the
before
child.
we go, Honorable Commissioner, because we're actually trying to wind up here, I can't but ask this question when it has to do with budget expenditure. Now, we've always had the issue of budgets are allocated to ministries, your ministry inclusive, and then when it comes to disbursements for programs, it becomes an issue. And it's been recurrent. I know I've had to go for trainings and workshops where these things are talked about. Now, what happens? Why is it that it is always difficult or it doesn't come timely to release budget that has been allocated to ministries to carry out jobs or trainings that it has to do with your own your ministry? What happens to those releases that are not made when it comes to releasing funds for training to different departments? What is the issue?
You know, I don't know how this budget issue is just like every other things we do in our families. Sometimes you budget for things, and if the fund is not there at that very time, so what are you going to release?
So are you saying that?
So, but what I'm saying is this: actually, we've been assessing our budget. We've assessed a significant amount of our budget. But what we're saying is that it may not be that today that the the money is supposed to be released and you get it today. So I don't think this.
So timely release of budgets then.
Yeah, it's very important. Okay. But there are other factors we know that can affect the release of budget.
All right,
even though I'm not in the best position to
answer
that because I'm not in Ministry of Budget.
So, the last question from me before we go. Thankfully, the first quarter of the year just ended. What was your major achievement in the first quarter of the year that just ended? And for the remaining part of the fiscal year, what are your top 3 priorities?
Well, now, for the first quarter, as I told you, we'll just establish our medical emergency services and ambulance system. We launched it like 2 weeks ago. I think your people also came. Then that is another problem that was facing Ministry of Health, because sometimes people delay in taking decision to go to hospital, and when they've taken the decision to even reach the hospital will be a problem. Or when there is need for referral, it will be a problem, because to even reach another hospital.
I forgot to tell you you have 30 seconds to answer this question.
Okay, sorry. Then another thing is the issue of we are building issue of solarizing our quorum. We just did that this quarter, and it's a very good, huge achievement for the ministry. Then another thing we plan to do, We also plan to digitalize the health, our health facilities.
All right.
Then we also have planned to build,
digitize the health facility,
build more quarters, because we want our staff to reside in the hospital, and also to build cool rooms in each of the 3 senatorial zones. We already have in the state.
All right, Honorable Commissioner, it's been a very interactive section with you. Actually, we can't exhaust all that your ministry has to do. Perhaps on another platform, we'll invite you to still inform Ebonyans.
Yes.
And we want to say a very big thank you for being
because one big achievement we've not mentioned is the issue of establishing drugs and medical commodity management agency.
That's our next
so we will talk about that in our next. We will invite you back for another section, Honorable Commissioner. And so it's been our pleasure, sir, having you in the studio, and for our listeners and viewers out there, we want to say thank you. This program will be continuing on Monday. My name is Laura Amanze, and of course, let's do it again next week from Monday. Thanks for being on the program, Amaka.
And thank you for joining us today on the ministerial account of stewardship for the 31 commissioners in the state. We had the Honorable Commissioner for Health, Dr. Moses Ikenna Ekama. Thank you, sir, for coming. I'm Amaka Izujugu. Keep safe.